Good morning. If you told me 10 years ago that I'd be presenting at a healthcare conference, I would have thought that would be a pretty crazy idea. My background is actually in astronautics and space engineering, so I spent the first 20 years of my career launching, operating, and occasionally helping to rescue communication satellites. But I didn't know at that time that for any of us, there can be a day that completely turns our lives upside down. That day for me happened 1 week after I took that photo of my kids in the front yard. My oldest daughter, Kate, and my son, Ben, they came down with flu symptoms, and shortly after, they developed the classic bullseye rash that indicated Lyme disease. They were quickly diagnosed and treated following standard of care, but they didn't get better. And over the next 3 years, my daughter, Kate, was referred to 30 different providers. She was given 15 diagnoses, and she was hospitalized 5 times. She went from a straight-A student to a special needs student who couldn't read a single page of a book. She went from the soccer field into a wheelchair, running pain levels 7 to 9 out of 10 round the clock for 18 months straight. And she had just turned 14. As her caregivers, my husband Frank and I were really overwhelmed. Her story had got so complex and confusing over those 3 years. It was no longer possible for us to walk in and tell a story effectively and really advocate on their behalf with their providers. So when their medical team, who were a fantastic set of 6 doctors with empathy, working together and trying to get her well, when they referred us up to Columbia Hospital in New York, we knew that as our caregivers, we had to do something differently. And we realized that her story had been piecemeal and across all 30 of those different doctors. So the first thing we did is we went out, we reached out to them, and we gathered all of her data into one place. And then we took that data and we put it into Excel spreadsheets, and there was 2 sets of data that we captured. The first was the clinical data, her lab results and a medication timeline, and the second was data that we had been collecting around her symptoms and how she had responded to those medications. The next step we took is we took that data and we put it into one 11 by 17 sheet of paper. And across the center, that middle line, is what we saw as the total burden of illness on our child. Every day that she tracked her symptoms, we totaled the total severity level and mapped it out. So the higher it is, the worse it was, the lower it is, the better it was. And across the bottom, we overlaid all the medical treatment trials that had been attempted to get her better. So you could start to see the cause and effect of each of those trials. And across the top, we matched out the abnormal lab results that had prevented her from recovering and caused her providers to stop those treatments. So using that data in combination to the clinical data, the providers over at Columbia Hospital were able to identify and unravel her story. They verified that the Lyme disease was still active. They found that she had developed an autoimmune disease in response to it. And they found that the inflammation from that had caused something called dysautonomia. 3 complicated illnesses, not well understood, with multiple symptoms that were overlapping. But because they finally unraveled her story, they were able to come up with a treatment plan that finally turned her around. And in 18 months, she was back in school part-time, she could read again, and she was even coaching a little sister in soccer. My son Ben went through a similar journey, and we used a similar approach with him. And I'm happy to say they're both happy and healthy college students today. But this journey taught me 2 things, and there were 2 things that really kind of knotted me up inside. The first one was, it was easier for me to launch a satellite than it was for me to manage my children's care. And the reason for that was when I walked into that launch control center, I had a system in front of me that I had helped design, that I had explained to the developers about what I needed, so that when I looked at those systems, I could see what was happening on the satellite, and I could respond to any anomalies. But as a caregiver, when I left an appointment or a hospital, I was given a piece of paper. And the second thing that I realized, and my big takeaway, was that we had become, over those years, experts as patients and caregivers. My children were 11 and 8 when they first got infected. And they were the only ones who could tell us how their illness was impacting them and what their symptoms were. They were the only ones who could tell us if the coping skills and the treatments were actually making them feel better. So they were expert patients, and my husband and I became expert caregivers. We were the only ones who knew how to keep our life moving forward despite their illness and to have fun with our family. We were the only ones who could advocate on their behalf and make sure that their voices were heard. But I don't know any other experts other than patients and caregivers who aren't given any tools other than a piece of paper to empower themselves to act. And it was that realization that made me leave the space industry and join Mitre, a not-for-profit organization who works in the public interest and who has an independent research program that focuses on issues of national importance. And this is an issue of national importance. There's 117 million chronic patients, like my children, and another 40+ million caregivers, like my husband and I. And that population, the 86% of the $2.9 trillion we spend on healthcare today is spent on their behalf. So there's a lot of evidence out there right now that shows that when you empower and enable patients to really actively participate in their care, you have an improvement in communication between patients and providers. We have improvement in quality of care, improvement of effectiveness of care, and we also have a reduction in cost. That evidence exists. But what we don't have is evidence that shows how do you empower the patients so that we can see those benefits. And that was the focus that Mitre took on our research. So the first thing we found is, since patients and caregivers aren't really recognized as experts anyway, there was actually a lot of doubt that we could collect information from patients at home when you can't actually see them versus in the clinical setting when they're in front of you. So the first thing we did is we collaborated with the University of Virginia, and we did a study with multiple sclerosis patients. So we collected symptom severity data at home and in the clinic, and we were able to show that, yes, the data that you collect outside when you can't see those patients is reliable as the data you collect within the clinic. It also showed that the patients who tracked their symptoms had an improved state of awareness of their disease state. We also collaborated with Carnegie Mellon, and we did a provider survey, and we asked them what sort of patient data would be helpful for them in the clinical setting. And they told us that longitudinal symptom severity data and longitudinal medication compliance data would really help them with their clinical decisions. So now that we knew that we could reliably collect the voice of the patient, and it would help the patient, and the providers needed it, we moved forward to start developing a tool. But Mitre is a system engineering company, and when we design or develop anything for an expert, we use a rigorous system engineering methodology. And we did the same thing as we developed a tool for the patients. We developed workflows of a chronic patient. What is it that they do on a day-to-day basis, day in and day out, in order to self-manage their care? What are the things that they do to prepare for appointments and when they're in an appointment with their provider? And we looked at those workflows, and we identified these difficult actions and tasks that patients had to do from memory by themselves with no help. And we figured out a set of requirements where we could build a tool to support and empower the patient to help them self-manage and to bring their voice to the care setting. Those requirements fell into 3 areas. First, helping them manage their day. Second, helping them track their voice and information and data. And third, being able to share it in a way that they, as patients and caregiver experts, could use it, and also the provider could use it. So we moved in to build a tool, the Patient Toolkit. It's an iPad app. It's designed in a way, on the left-hand side, you'll see a schedule. The schedule has everything in it. It's got their medication reminders, it's got their appointments, but life doesn't stop when you're sick. So you can also add in your basketball practices, and you need to pick up your groceries. There's a checklist of everything you need. So it's your schedule. There's something we capture every day as well, and that's the "how are you feeling today" question. And the reason we captured that is in the first clinical study we did, we showed that one single question reflected very closely to the level of fatigue, pain, and depression. We did usability testing with patients to make sure and identify whether there were any changes we needed to do to make it easy and simple to use, and we made those modifications. Within the tool, we also help the patients collect information about them so they have a voice and can tell their story. It's very hard for chronic patients to actually even identify a full list of symptoms sometimes. My daughter had 26 of them at her worst point. And if you've got high levels of pain, you often don't notice that your toes are tingling. And if you've had a condition long enough, some of these symptoms just become your new normal. So when you walk into that provider's office, you don't even think to tell them. So within the tool, we have a checklist. It's a simple checklist. They go through it. There's symptoms from every illness. It's a generic list. And they go through and they identify a full set of symptoms across all of their disease states. And then once they've done that, they get a personalized tracker that allows them to simply and easily collect the symptom severity level whenever they feel like it. Second set of data that we collect is medication data. So within the toolkit, we have a list of all the medications. We had 6 providers, and 4 of them prescribed medications. So we were the only ones who had the full list of data because they all had different electronic health record systems. So the tool collects that information for them. And then once you've got that medication entered, you get a reminder. But the reminder allows you to say, I'm going to skip the medication today, because patients are experts. And there are really good reasons why they're going to skip the medication sometimes. For my daughter, if she had an exam in a special needs class, we skipped a certain medicine, because that medicine made it difficult for her to focus and think. So we had really good cause to skip that medicine, and we did. The important thing isn't that we didn't comply. The important thing is we were able to tell our providers why we couldn't comply, and they were able to change the treatment plan to be something we could follow. So we were able to share our expertise so their expertise could help improve our outcomes. Both on the symptom data and on the medication data, we also track and map to the appropriate data standards. Many patient apps out there, they collect data. They don't map to standards. So you can't integrate them into the provider's systems. You can't share them in a way that can really be leveraged. So the symptom data is mapped to SNOMED CT codes. The medications is mapped to RX norms. So the medication name in the system matches what's on your prescription bottle, and it matches what's on the electronic health record system. The other data we kept is a journal feature. Research has shown that when chronic patients journal, they get better, or at least in general, their outcomes are better. So we have a journal feature built in. You can either put in text entries, you can also take photographs of joints or things that come and go between appointments. You can even take it of a plate of food if you want to show how you're arranging your diet. But in addition to journaling, you can actually tag any entry as a provider's note. It's really hard when you've got appointments 2 months apart and you walk into that provider's meeting and you're trying to remember everything on the spot that you have to tell them. This way you can search through and find the notes that you wrote for that provider, and you've got them right in front of you. And the last piece that we give to the patient is an appointment checklist. So they can actually prepare ahead of time for the appointment, figure out what they want to ask and the goals. It's really stressful walking into an appointment and trying to do that off the top of your head. So it's a very simple tool. We visualize the data in a variety of ways. We actually talked to both patients and providers, and everybody wanted to see it differently. So we have a visualization that's built in. It's a graph visual. You can go left to right on the iPad and scroll over time. Across the top, you can see individual symptoms and how they're fluctuating with time. The next one down is that total symptom load, or the total burden of symptoms on the patient. Below that, you'll see how are you feeling today. And below that, you see the medication and whether they took it or not. So from a provider's standpoint, they can really see and go, and you can adapt this and change the scale if you'd like to. But the providers can look at it and say, when I gave them that medication, what were the symptoms that improved, and what were the symptoms that got worse, with accurate information collected in real time. But the patients also can use it. So a lot of patients, the first time they know that something's going wrong is your gut knots up inside, but you can't figure out why. And so you tend not to pick up the phone because you don't know what to say. So with the tool, if your gut starts knotting up, you look at those bars, the gray bars, and if they're starting to go up, that tells you, yes, your symptoms have been getting worse. And if you tap on that bar, it'll show you exactly what's happened to your symptoms. And that will empower you then to pick up the phone earlier before it reaches crisis and talk to your provider. For those who don't like graphs, we've also got a visual display with a dashboard. Shows similar information, and again, you can drill down into it so you can see what happened on any day. But patient empowerment is not just about an app. We've got thousands of apps in the App Store. And technology is moving so fast, we're going to have thousands more pretty shortly. So that's not going to help. So what we're doing now with Mitre is we're collaborating with the Billings Institute in Montana, a really innovative rural hospital. And we're doing a clinical study. And we're putting the patient toolkit in patients' hands, and we're evaluating what the impact is to the patients and their outcomes. But we're evaluating more than that, because it's not just about what's happening to the patient. To really get this broadly adopted, we have to understand how these tools impact providers' process flow, provider decision-making. We have to understand the cost implications on the hospital. We have to see if, by increasing patient self-awareness, we actually reduce the number of ER visits. And if we do, we're reducing costs. We also need to take a look and see, from a policy standpoint, the Mitre legislation introduced all these new payment models that encourage and incentivize the use of patient data and engagement of patients. So how do we actually, does this tool and the data it provides allow additional payments from things like CPC Plus, for example? Without doing studies, we're never going to find that out. And the last piece is, as we go through this study with the clinic, we're going to extract out and see exactly where the providers, the nurses and the doctors want to see that information in their process flow. And we're going to identify the places within the electronic records, health records, where they want to see the data, and we're going to extract a set of requirements to show how this data needs to be integrated into the EHRs. EHRs don't have repositories where the patient data is mapped to the appropriate data standards, so providers can look at that data alongside their clinical data. So we need to get requirements in order to specify that, and that's partly what our study will be doing. If we focus on if we really take these tools that patients are doing and we focus on getting the evidence in terms of how we can roll this out practically and we can actually enable this model, now we truly empower the patients so they're not just in the center of care, but they're actually equal partners with their care team and they have an equal voice. We're lucky we had the support and we had the resources needed to be an empowered family of patients and caregivers. I'm incredibly proud of my family. The fact they came through 8 years of very difficult time a lot stronger than we went in. But there's 117 million patients out there who deserve to have that same voice. So my call to action to you today is how might we include the voice of every patient and caregiver in every element of healthcare, from strategy and policy to the development of payment models, to looking at processes both inside and outside the clinical setting, development of technology, and also for measuring outcomes. I ask you, recognize the value of the patient voice and think about how you can integrate it into what you do every single day. Because once we can do that, there will never again be a patient who's released from the hospital or from the clinic and are expected to empower themselves with just a piece of paper. Thank you. We do have a few minutes for questions if anybody has any questions. I would ask you to use the mic if you could. No questions? Okay, thank you. Oh, I'm sorry.
I just want to say thank you. I'm almost in tears because I'm a caregiver and the work you're doing is just amazing.
Thank you.
But I want to know what challenges you anticipate and what successes you're hoping for in terms of rolling something like this out.
Yeah, thank you. We actually did a lot of research on the challenges, which is actually why we've done our study design the way we have. There's a lot of challenges in place today. One of the fundamental ones is culturally the lack of recognition of patients and caregivers being experts and the value of the data and the voice that they can provide. So that's culturally why I'm going out to conferences and I'm speaking on this issue so we can make people understand the value of this content. But from the entire end-to-end system standpoint, the one I mentioned earlier on the electronic health record systems, the fact that we don't have a proper patient-generated health data repository that's mapped to standards that providers can then put in parallel to their clinical data and use to make better decisions is outrageous in my mind. So that's a very big one, and one of my asks is going to be, we need electronic health record systems to include this data so that our tools for the patients can integrate in and that data can be leveraged. The other big one, and I think we're definitely moving in the right direction, is our policy. So the macro legislation introduced some new policy payment models, and they do encourage the use of this data. But they also, from an outcome measures standpoint, a lot of the measures, the patient-provided piece of the measure is purely around satisfaction values. So a lot of those clinical measures can be really great, but as a patient, you might be in bed with so much pain that you can't get out of bed. And that, to me, is an imbalance. So these are some of the hurdles that we're recognizing, but I think the important thing is that everybody working in the healthcare space starts contemplating how this type of data can be leveraged in what they're doing in order to move us forward. And by doing that, what I expect, it's not about the app. What I'm looking for is that these capabilities will be everywhere. They'll be built into home nursing systems. They'll be built into patient portals. Why do we ever put a patient on a spot and say, so what's been going on in the last 2 months? Right? We don't do that in any other industry. There's no reason. A simple checklist, that's all it takes. And then capture the severity, right? And then just track that data over time. We have one other question?
Thank you, and it's, I think development of applications like you've developed can be enormously helpful to help, collect a source of data that is often not part of the record that is critical. One of my questions is when I've seen applications built that have that potential for utility, one of the biggest struggles is getting people to use it. So
Yeah.
any thoughts about your strategies around patient and caregiver adoption?
Absolutely. I think one of those reasons is because when people develop apps, they don't think about that process that the patient has to deal with every single day. When we did an environmental scan of existing apps, what we found is apps are focused around one disease state, one issue around a disease. We had 3 complex diseases going on, right, and illnesses. Well, I would have had to have a suite of 7 or 8 tools to deal with what I was dealing with, right? So we need to actually get in the mindset and start thinking from the patient's shoes and really looking at what the patient needs in order to incentivize the use, because if it doesn't help them on a daily basis, they're not going to pick it up first thing in the morning and keep it with them all day. And I think that's one of the biggest hurdles of all. My hope is that we move away from that. We really start engaging experts, patients as experts, and understanding what they need and giving them what they need. And I'm just out of time, sorry, but I can catch you afterwards. Thank you very much.